This segment of Delmarva Life is brought to you by Peninsula Home Care.
All right, let's do this. When you think of your body, think of your heart as the battery. It keeps pumping to keep everything else working. But if something goes awry, let's say your heart doesn't pump enough blood to support your body, well, that's when you could be in danger of something called congestive heart failure. Now, we've talked about it before. The name can be a little bit misleading. It doesn't mean that your heart has failed. It means that it doesn't work as well as it could, and that is a real problem. Studies show congestive heart failure is one of the most common reasons for hospital admissions among those 65 and older. So here to tell us more about how we can try to put a dent in those numbers, this is Beverly White. She's the branch director of Peninsula Home Care at Nanticoke. Thank you so much for joining us today.
Thank you for having me.
So, do I understand that one of the biggest problems is a lot of people don't know when they have congestive heart failure?
That is true. Often people get caught in that misleading thought that it means that their heart isn't working.
Right.
So they don't always get it checked. Congestive heart failure is actually very common and a disease that's easily managed.
Right. So, okay, let's say we got a loved one in the hospital for congestive heart failure. They're going to get round-the-clock attention and care, but they get discharged. They come home. That's where you guys come in.
Absolutely. Peninsula Home Care is a really important member of your healthcare team. When people are in the hospital, they, as patients and their families, caregivers, don't always understand what's going on, maybe a little confused, and especially when they get home, they don't always remember everything they were told to do. Our home care team is an important part of making sure that you stick with that plan of care and continue the education so you can continue to be well, your wellness, recovery.
So does congestive heart failure mean a change in lifestyle?
It does. There's certainly the obvious with any disease that we'd want you to take your medications as prescribed and keep with doctor's appointments.
Right.
But there are some important lifestyle changes that need to happen, such as monitoring your blood pressure every day, maintaining a stable weight, monitoring your sodium intake, and fluid balance is really important for congestive heart failure patients.
Okay, so, and you've got something to help do all this, right?
Yes. We do. We have the Telehealth system, and what it does is it is a monitoring device that your home care team will set up in your home with a wireless modem. It allows us to check your daily measurements for your blood pressure, your pulse ox, which means how much oxygen you have in your blood,
Right.
your blood pressure, and as well as your weight. So it gives us an opportunity to see if there's any fluctuations in your symptoms on a daily basis.
Right. It doesn't take the responsibility off you because you still need to do it, right?
Absolutely. So when the patient gets on every day and checks their measurements for the day, that information is sent back and the nurse looks at it 24 every day,
Right.
7 days a week, even on the weekend. There's an opportunity then we can look at trends, look at the measurements over up to a 30-day period. We can send the nurse back to your house if you need an extra visit. We can call your physician and make modifications to your medications, or we can even decide if your symptoms are so alarming that you should maybe go back to the emergency room. Our goal, though, to you and commitment to you as a patient is to try to prevent you from being readmitted or having to go back to the hospital.
Right.
So that's why we monitor it every day.
So will this replace the nurse or the therapist?
No, it's really an educational tool as well, because your nurse during this time is going to be continuing to provide you with education, you and your caregivers, so that when our time with you is done, you continue to do your measurements and check your symptoms every day as you continue on.
Telehealth has been a really good thing for Peninsula Home Care, hasn't it?
It sure has. It has helped a lot of patients. It has also held them to somewhat accountable to taking care of their illness, and people are getting better, staying well.
And you guys are really good at helping.
Yes.
Beverly,
thank
you so very much for coming in today.
Thank
now,
you.
if you would like to know more about telehealth and Peninsula Home Care, all you have to do is go to delmarvalife.com.